Hi, everybody, and welcome to another segment of MedTalk by Medical Tourism. I have here as my guest Dr. Carlos Garcia, who is a urologist with over 30 years of experience, and we're talking about prostate cancer, an issue that concerns most men. And we have a very interesting questions regarding people who are in other countries and would like to travel to Vallarta to get that treatment done. Hi, Dr. Carlos, how are you?
Hi, how do everybody?
First question is, if I'm abroad, can I start my treatment via virtual consultation with you guys?
Yes, absolutely. We're using a system that let us be in contact as a Zoom. It's a different system, but we can share tests. We can share some information about the testing of the prostate diseases. And we usually use it in advance before asking the patient to come, so we can know and understand the disease, so we can give all the information and suggestions and consultation advices for the treatment.
And if I'm a candidate, how long do I have to stay in Puerto Vallarta? How long do I have to plan my trip, my stay there? How many days or weeks?
We usually give in advance all the details for preparation for the treatments, considering HIFU as the main option. We ask the patient to arrive 1 day prior to the treatment so we can meet and give all the details for the preparation. The following day is the treatment, and at least we ask another couple days to give the follow-up of the acute moments of the treatment. This kind of treatment is very well tolerated. So after the second, third day, we usually have a good control without needing to be in Vallarta. But if it's possible to stay a week or two, okay, of course, we will take care of all the process of the treatment, including the removal of the catheter. But at least 3-4 days is good enough to do the procedure and take care of the original first days after the treatment.
And is there a way for me to know prior to my arrival to get in contact with you guys and to know what type of procedure or surgery am I candidate for?
Yes. In this virtual consultation, I usually ask a copy of the file of the tests done. One, of course, is the PSA, the prostate-specific antigen. This will guide more or less the extension of the disease. The second one is the biopsy report, because this will give us a very accurate idea of the aggressiveness of the cancer. And in some cases, we ask another kind of tests like bone scans or MRI or even PET scan, that they will help us to understand the extension outside or inside of the prostate. With these tests, is enough to know if a patient is candidate for a specific treatment like focal therapy or a surgery like radical prostatectomy or even a radiation or hormone blockage.
Thank you very much for your time and for your questions, doctor. So there you have it. If you want to see the full interview in Spanish, check the link below. We're going to leave the link to the online consultation for Dr. Carlos Garcia's clinic so you can get in touch with him and ask a couple of questions. Thank you so much for your time, doctor. And until next time, this was a segment for Medical Tourism by MedTalk.
Thank you very much, and see you soon.